What is informed consent? It's an agreement between the healthcare provider and the client. It is signed by both, and it is done prior to non-emergency surgeries or procedures. It must be obtained by the healthcare provider. Whoever is performing the surgery or procedure should be the one explaining that information, and that's normally the healthcare provider. This needs to be done prior to the procedure because not doing it could be considered battery. There are some exceptions to this. That is when the client requires an emergency life-saving procedure. For example, if the client is unconscious and is brought in a traumatic situation and we need to immediately take them to the operating room and they are unable to agree to consent. In this case, it is understood that the healthcare provider will act in the best interest for the client. There are different types of consent. Admission agreement. This is when the client comes into the hospital, they sign a consent agreeing to be treated in the hospital. Immunizations require a consent. Blood transfusion and blood product consents are separate from surgical consents. We can't assume that a client who agrees to have surgery would also agree to have a blood transfusion. Some clients, due to cultural or religious beliefs, will not accept blood transfusions. So this is a separate consent from the surgical consent. Research requires its own consent, and we'll talk about that in just a little bit. Genetic testing requires consent due to the potential life-changing information that may result. Then there are other special situations that require consent. Restraints, autopsy, photographing a client. Let's talk a little bit about the components of consent. The preconditions, capacity and competency. A lot of people think that these are interchangeable, but they're not. Capacity is the actual decision-making skill of the client. Can this client make a decision? Can they be given information, and do they have the ability to make a decision? An example would be a client who comes into the emergency department and has appendicitis. They are given the information that if you do not have this appendectomy, you could die. So can this client take in that information and make a decision? Competency is a legal judgment. After assessing the client's capacity, it is determined whether the client has the legal right to make their own decisions. Informed consent should be voluntary. The client should not feel coerced or forced to signing a consent. The client can't be bribed with money or favors to have a particular procedure. The client can withdraw consent at any time. They may have signed the consent earlier today, and now it's time to go back to have the surgery, and they can say no. That is their right. When the healthcare provider is discussing the procedure with the client, they will want to include a couple different points. The diagnosis. Why is it required that this client has this procedure? The planned treatment and procedure. This is important because the healthcare provider has to explain it to the client in terms that the client can understand. So you might have to include interpretive services for this part. The provider will talk about the probability of a successful outcome, what we expect to happen. Then the provider will also talk about risks and benefits. They'll talk about the most common complications. They won't go over every single complication, but the most common ones. They'll also go over rare and major complications like death. The provider will discuss with the client alternate treatment options and also prognosis without intervention. The client has every right to say no to a procedure or treatment. It should not have any bearing on the other supportive care that the client is receiving. For clinical trials and other types of research, a consent is required. It is normally obtained by one of the research team members. That team member will discuss the risks, consequences, and benefits. They will also discuss what the client obligations are. With time constraints, is this a 2-year study? Is it a one-time study? Do they have to fill out paperwork? Those kinds of things. Again, the client can withdraw their consent at any time for any reason. They can say, no, I don't want to be a part of the research anymore, and they can stop. The team members will also want to include the purpose of the study. Guidelines determining competency apply to all clients, with or without mental illness. A client with mental illness can give or withhold consent unless they have been deemed legally incompetent. Examples of clients who would be considered incompetent would be clients who are experiencing delirium or a psychotic episode, clients who have taken mind-altering substances like opioids or alcohol, or clients who have already been deemed legally incompetent. We will need to take special considerations for those clients who have been deemed legally incompetent. We will need to reach out to the next of kin, power of attorney, or legal guardian to obtain consent. In discussing minors and informed consent, laws vary across states, countries, and areas in which you practice. Normally for a minor, the guardian or parent will sign the consent. There are some special considerations in different areas in which a minor can sign their own consent. The role of the nurse with informed consent is very clear. You as the nurse are not responsible to give detailed information about a surgical procedure. That is the healthcare provider's role. But we as nurses can do some things. We can witness and verify voluntary client signature. We can clarify facts that have already been given by the healthcare provider. We can answer those questions. We can ensure competence and understanding of the procedure and also of the healthcare plan, wound care, diet, aftercare after the surgery. Once the informed consent has been signed, you do not want to modify that document.